Welcome to our series, Moving America Forward. Each week we'll be focusing on America's entrepreneurs as they take us to new roads, new opportunities, new ways to fill the gaps left by today's failing companies. Our series will be looking at that and a lot more. So come with me and watch as the entrepreneurs of our nation move into the future.
And I'm Doug Llewellyn here in our studios in Los Angeles with our guests today who are from a company named TruBridge Incorporated, headquartered in North Canton, Ohio. Our guests, by the way, before I introduce them, I want to point out this is a company that specializes in health insurance, specifically in Medicare health insurance plans and Medicare Advantage. And it's a very complicated field. I think you're going to find this very interesting. By the way, this company was named the 2014 Business of the Year by the Chamber of Commerce in North Canton, Ohio. I'd like you to meet our guests now. Here on our left, Matt Tucker, who's the president of the company, and on his left, Jim Tucker, who's the vice president. Gentlemen, welcome. Nice to have you with us.
Well, thank you.
Let me point out, a little while ago, Matt, you had a chance to answer some questions from William Shatner. Let's take a quick look at a portion of that, see just how it went. Okay?
Great.
Let's watch.
Good to have you here. I'm very concerned about health care. The real issue is how do we keep Americans healthy? And I understand that is one of your goals. So tell me, what are you doing to help us stay healthy? Any new procedures and developments that help people to live more productive lives and in so doing move America forward?
Mr. Shatner, with Obamacare in full effect and the laws and policies of Medicare constantly changing, Americans everywhere are struggling to find the right kind of coverage for them and their families. What we do is help them understand their options and make sure they have a plan that covers them when they need it most. That, Mr. Shatner, is how we are helping to move America forward.
Well, that was really very interesting, to say the least. I must tell you, I understand that what you do, and especially advising people in the world of Medicare, is certainly something well worth doing. And it's interesting to know, and I have some statistics here, that every day 11,000 people age into Medicare, thus continuing the rapidly growing need for education on the field of Medicare and the process and the enrollment about it. Also, it is very, very complicated. I know that your goal is to take the burden of understanding how Medicare works, and you're a resource for people to turn to get advice on exactly what happens when it comes their turn to get into Medicare. Why is it so seemingly complicated?
No, that's a great question. Medicare, you know, when most people are working, generally their health care is taken care of by the HR department, and they're not really involved with that.
Of their company.
Right.
Right. Yeah.
So it's not really something they have to think about. Then they become retired, and now they're responsible for all the choices, and there are a lot of them. There's Medicare Advantage plans, Medicare Part D plans, Medicare Supplement plans. It just goes on and on. And we find that people, once they're retired, they're trying to enjoy their retirement. They're not really looking to become healthcare experts. So we try to help them navigate that and take that burden away from them, so it's one less thing they have to think about.
Well, you know, I thought when you signed up for Medicare that Medicare is pretty standardized all across the country. You just go in and sign, I want to sign up for Medicare. Is that right, or am I wrong here?
You're right. You sign up for Medicare, and they take care of part of your health expenses.
Right.
And you're responsible for the other part, which is an 80-20 arrangement.
It's the supplements.
It's
the
a supplement.
supplementary insurance. And really, you need that supplementary. Well, let me ask you, instead of my saying that, let me ask you, why do you need the supplementary insurance?
Well, the 20% that you have to pay can be monumental. It can add up, and there's no real cap to it. It can, you know, a $100,000 bill for a major surgery, and you're paying $20,000 of that or more. So the supplement comes in play very handily because it'll offset that 20% for you.
So that's it. Medicare pays generally 80%. You've got to come up with the other 20%. And if you have that supplementary insurance, basically, does that cover the full 20% or not always?
Well, it depends on the type of plan you get.
Okay.
Medicare supplements are generally designed to cover that other 20%.
Right.
And that's where we get into the complication of the type of plans. Generally, those are more expensive monthly, but you have less out-of-pocket expense. Where Medicare Advantage is more of a pay-as-you-go, that's managed by the insurance company, where you pay a much lower premium and you pay as you utilize the plan. You know, and back to original Medicare, I think one key thing to remember is traditional Medicare doesn't have any additional benefits such as dental or vision, Silver Sneakers program where people can get access to health clubs, Part D prescription plans, as my dad mentioned, out-of-pocket caps. So there's a lot of reasons that you'd want to look into having additional coverage besides just Medicare.
So how do you work with people when they come in and inquire? Do you kind of evaluate what their situation is, where they are? What's the story?
No, absolutely. We have an unbelievable staff of licensed employees. We have over 230 licensed employees in our contact center in North Canton. They're all highly trained. They go through 320 hours of initial training that we put them through, and then they have 160 hours a year that they're updated on all the healthcare changes.
That's a lot.
It's a lot.
Yes.
But it's confusing, and every year you need to stay abreast of those changes. But when someone calls in, everybody's situation is different. So we go through a needs analysis and we help find out what are the key points that you're trying to cover. Some people want to be able to travel and know they have coverage everywhere. Some people want to have the lowest cost plan, even if it has a restricted network. Some people are concerned about prescription drug cost. It's really different for every person we talk to. That's why we need to really understand all aspects of the Medicare system so we can help them.
And the prescription drug, that's something else entirely, isn't it? I mean, they're the supplements for the health care, for the medical coverage, but then there's the drug coverage as well to help pay for prescriptions. That's totally different. And then there's other Silver Sneakers. You know, it's interesting. It's a term I wasn't even familiar with. What is that again?
A lot of the programs we deal with, the carriers, they offer a program through an organization called Silver Sneakers where they've partnered with the YMCAs or other local fitness centers, and those people get access, the members will get access to those programs to obviously get in programs and stay in better health. It's really a way for them to get active and maybe go somewhere where they haven't been doing those activities.
The idea is to keep them from needing insurance at all, right?
Right.
Keep them in good health. All right, to get back to the supplemental insurance thing, there are, as I understand it, categories. I guess this was established by the government or the, you know,
CMS.
in the beginning.
In the supplement world, those are all standardized. So if you get it from A company or B company,
It's going to be the same.
it's going to be the same. The difference is the premium, the carrier rating, customer service, those type of things.
Yeah.
And that's what you're talking about when you hear about the enrollment period every year, is that right? That you have to enroll during that period of time? Or is it any time of the year you can enroll for that?
First time you turn 65,
Yeah.
you don't have to wait for the enrollment period, but afterwards you go through the annual enrollment period.
Okay. Well, it's a very worthwhile service that you provide. And a lot of people generally just don't know, do they?
No, they don't. It's very confusing, and there's a lot of additional benefits that someone on Medicare may qualify for, and they don't just because they don't understand or they don't apply for them. One of those would be a low-income subsidy program. This is where someone who, based on their income, they may qualify to get their prescription premium reduced or eliminated, their prescription deductible, their co-pays lowered. And that's a program there's a lot of people eligible for. They just don't apply or they don't know to apply.
You know, I should mention the Obamacare issue. It's so talked about, and I don't know what the impact eventually is going to be on the insurance agency. But how do you guys deal with that at this point?
You know,
it's very complicated because you don't know.
We're like most people. We're kind of sitting on the sidelines. We're helping people answer the questions as they are today, but we understand in the future those issues are going to change because it's evolving. And what Obamacare is right now, next year it won't be, and the next year it won't be. So as those things change, we'll keep up with them and be able to advise our customers on those changes and help them. But yeah, that's a big issue that's come on.
Well, it's a pretty fascinating story about what you do, what you provide. I'm also intrigued by the fact that your headquarters is in an old Hoover vacuum cleaner factory, right?
Yeah.
Which is
was
great.
a home office at one time.
It was the home office?
I think so.
Yeah.
Yeah.
600,000 square foot building.
600,000 square foot building. Very,
Awesome.
Very. Well, are there any tips you can give? When someone comes in and sits down and says, "Look, what should I do?" You just have to evaluate what their situation is at the moment and what they can afford.
Sure.
Really, is what it comes down to, isn't it?
You want to get them the most for the least cost to them, the best benefits for the least out-of-pocket cost. That's kind of our rule of thumb, the best coverage that they can get.
And what was your background before doing this? You've been in the business for a long time.
Between us about 40 years, 20 years. We've been in it a good while, yes.
And have you focused on this aspect of it, for most of that period of time?
We focused in the senior market the entire time.
Okay.
Whether it was life insurance, annuities, Medicare supplements, Medicare Advantage. So we have a great deal of experience dealing with this demographic and understanding the issues that are happening there. And we feel like that gives us the ability to really help in those situations.
Well, as I've said before, it's certainly well worth the service you're providing. It's very good indeed. It's TruBridge is the name of the company in North Canton, Ohio. But again, you provide the service in some 46 states all across the country. Gentlemen, thank you for being with us. Very interesting indeed.
Appreciate it.
You're welcome.
This organization represents companies across our great nation that embody the spirit, dedication, know-how, and can-do attitude which has made America the great nation that it is today. And now let's present the Keeping America Strong Award.
Now it's my honor to present this prestigious award to Matt Tucker and Jim Tucker of TruBridge of North Canton, Ohio, for the outstanding work that their company is doing to help keep America moving forward. Gentlemen, it's a real pleasure to give this to you. Congratulations.
Oh, thank you. Thank you so much. We really want to honor the people at our office who we believe have given us the opportunity to receive this award. Our employees are the backbone of our operation, and the great work that they're doing to help people find the right plans in Medicare is kind of the reason that we feel like we're making a difference in America. So we definitely want to thank them.
Absolutely.
And thank you for having us on here.
You're very
Doug,
welcome.
we appreciate
indeed.
it.
Thanks again.
That's it for another edition of Moving America Forward. I'm Bert Tenzer. Join us again as we continue to bring you the entrepreneurs who move America forward.
I'm William Shatner, and for all of us at Moving America Forward, thanks for watching.